Today I'm going to vlog not exactly about something, but I just want to share my experience with finishing my first travel contract here in America. So, like what I've said previously on my vlogs, I tried working on a local travel assignment, which is here lang in Cincinnati, Ohio. It's like 25 minutes drive away from my home. So, I just finished my 13th week contract, but I extended it for another 13th contract. So, when I decided to extend my contract, it was too early na I didn't notice that it shouldn't be. Like, for me, so I'll go straight forward. One of my advice is that sometimes 13th week contract is already enough. Kasi nga, for me, parang hindi na rin kami naging masyadong needed on that organization. Ayun nga, kasi yung naging experience ko was like, before the end of my contract, they were asking me to go to another specialty. Like, this specialty that I had is med-surg, tele, step down in one. And the craziest part is mostly are geriatrics. So we don't have patients that are middle-aged. Mostly are geriatrics talaga, ranging from 60-year-old to even 90-year-old ang mga patients. So it wasn't a problem to me at first kasi I'd been working on rehab facility na marami din namang geriatrics, and I don't have any issues dealing with geriatric patients. But here in step-down, telemetry, med-surg unit, geriatric patients are very complex. So, complex sila in a way that they experience dementia, they experience hallucinations and everything. Like, it's really like, nagmamanifest na yung mga end-of-stage symptoms like UTI, a lot of confusion. So many of the patients that we handled in this unit are jumpers. So jumpers sila in a way, but they don't have any sitters. So majority, mostly on the night shifts, we handle like 5 patients. And to think of that 2 of your patients or 3 of your patients were jumpers, but they don't have any sitters. So it's really challenging for me because these patients are really highly risk for fall. So there's too much liability for that if these patients fall. Initially, I liked this unit because they have a fixed ratio. Like, they have, on nights, we only have 5 patients, and on days, they only had 4 patients. So, it seems to be good naman, because when I work on LTAC, although I haven't experienced it, so we can go up to 7 in there, and patients are ventilated at the same time. So, it's really rough also. So, kaya sabi ko, 5 is enough. 5 is not too bad at all. But the mere fact that night shifts on this facility, on this unit, we admitted it from raw. Like, we get the patients directly from the ED without any transporter. So, we are the one na maghahanap ka dun sa ED kung nasaan yung patient mo, and you will get the report, and you will, talagang ikaw lang yung magtatanggal sa monitor dun sa patient mo. No one would help you there. So, it's a stretcher bed naman yung bubuhatin mo, but no one would help you. It's a very independent task talaga here. And then, when you go to the unit, thankfully, if may tutulong sa'yo, but most of the times, it's all you. So, the one thing that I like here, all the PCA that I met were like very young, and they were like nursing students, and they were very parang helpful, very eager sila to learn, so they were there to help me. So in terms of the PCA, in terms of the nursing attendant, it was nice kasi I rarely experience na walang PCA. Kasi when I work on LTAC, minsan wala kaming PCA. So we do total patient care with our patients. We do our vital signs, we change the bed by ourselves. Pero here, we have PCA. Yun nga lang, a couple of times, minsan kulang din. Like, we only got 2, so each hallway lang yung PCA. So, we have to give our fair share. Like, one of our patient would be our total patient care. So, last time nga, they were asking if sino yung total patient care. But, 5 of my patients were like, immobile, jumpers, and I don't know how I can handle it by myself only, na walang tutulong sa akin na aid. But, ayun nga, natatawa ko nun kasi yung PCA ko na ng time na yon, sabi niya, you have to choose this patient kasi this patient seems to be easy, although AFib din siya sa monitor, so we need to monitor her, and then at the same time her blood pressure was getting low. So, medyo monitoring din tong patient na to. Pero siya na yung pinaka-easiest so far kasi hindi naman siya ganun ka-elderly. Like, she's only on 60s. But the rest of my patients were like 90-year-old, 80-year-old, very confused patients. And this one is very alert-oriented naman siya. But this patient is very, nasty. Nasty talaga siya to the point that she was yelling to everyone that will go to her room. She was like telling everyone na you can see kung ano ba yung gusto niyang mangyari. I need a doctor right about now. So, sinabi nga sa akin ng PCA ko, you have to choose her because she was very difficult. I was like, sabi ko, I have no choice. Kasi siya lang yung pinaka alert so far that I don't need to check from time to time. Unlike the other 4 patients na very confused talaga. It was really a struggle. That unit is really a challenging itself na. Challenging na siya. And at the same time, na-experience ko rin talaga yung mga attitude ng mga young nurses. Well, I don't have anything against young nurses because I once became a young nurse din naman. I was very, may pinaglalaban, you want to prove yourself to everyone. So, ito pala yung feeling nung when you're dealing with these young nurses. Like, they don't even care. They will not even bother to help you. And at the same time, when you ask them, they were like rude. I cannot say any detail anymore. Pero I really experienced like a lot of rudeness from this young nurses. Which, sabi ko nga, I was too old to be bothered by this. Kumbaga, I just let it pass. I respect din yung iba't ibang attitude ng mga tao, and we all know that we are born differently, we are raised differently, so I respect that. But sometimes some of the experience that I had were below the belt, that I have to gather myself Kasi really stressful talaga. Like, I experienced being teased with my highlights sa hair ko. Maybe because they thought I was like trying to be an American. So I was trying hard to be an American, where in fact I was really an Asian. Pero yun nga, I colored my hair for a change. Kahit naman sa Philippines, nagko-color naman ako ng hair. So I heard a lot of things like they just wanna wash their hair to expose the real color of the hair daw, ganyan. But ayun, I really don't give a damn about it. Kumbaga, tatanda din kayo. Alam mo yun, there will come a time that you will choose your battle. And this battle, like yung mga pangtitis na ganyan, will not matter to you anymore when you grow up. So, sabi ko na lang, I respect your being young right now, that you have time to tease other people. And there are a lot of stuffs din that I feel kasi na parang it's very questionable that it's very questionable for a staff that there are travelers. Like, you have the same job pero you have different kind of pay. So, it's like normal for them na parang they feel insecure. And at the same time, I'm of different race and they were like born here in America, but I was earning more than them. I know the feeling naman. Kaya sometimes, iniisip ko na lang that ako na lang iintindi. Kasi these people, their perspectives in life are hindi masyadong straight, hindi masyadong concise. So, siguro ang dali lang sabihin nito, but yes, it's been a very stressful and very stressful talaga siya. It causes a lot of anxiety. So yun, kasi lately kasi nawala na rin yung mga travelers dun sa unit na yun. So may mga nag-give up talaga. May mga nag-give up din talaga. Meron nga ako dun kasi 3 kami na bagong pasok doon. 4 naman kami. Yung guy, medyo guy naman. Wala, yung lalaki kasi di ba wala naman pakialam yan. Basta papasok lang. Kahit saan siya idalihin. Kahit saan siya i-float. Wala siyang pakialam. Nakatawa lang din siya. Tapos, itong dalawa kong kasabay, hindi ko na sila nakikita. Kami yung palaging nagkakasalubong ang 3 kapag duty kami. Tapos, tawa kami ng tawa. Tapos, hindi namin makita yung mga supplies, hindi namin makita yung mga bagay-bagay, or sometimes may mga questions kami na parang hindi namin maintindihan kasi syempre, iba-iba naman yung policies ng hospital. So, yun nga. Ako, matanong talaga ako. I don't care if you think I look stupid, pero there are also people na hindi ka talaga i-answer. Doon sa unit na yun meron talagang people na parang sasabihin nila they will help, but they will not come. So, sometimes, we travelers rely to each other na lang din. But of course, sabi ko nga, I don't care. I get it if you think I'm stupid. As long as alam ko naman sa sarili ko na I'm not stupid. I will still ask. Kasi I want to be certain kung anong gagawin ko. I want to be sure kung anong gagawin ko rather than gawin ko hindi ko naman alam. Kasi, okay, if they think that they know everything, well, ako, hindi eh. Hindi ko naman talaga alam lahat. Kahit I floated to a lot of areas, I work on different unit, even in the Philippines. Siyempre, everything is a learning phase pa din. Iba-iba talaga ang mga pangyayari. So, yun yung mga struggles ko dun sa unit na yun. And then, another thing is, we always get floated first. Of course, that's the rule. Travelers will always get floated. You were there to help the whole organization, not just for the unit. So, as far as I know naman din, we are only floated to the similar specialty that you had. So, if mostly tele units lang din yung pupuntahan mo. Pero the last time, I was floated on oncology unit. Well, hindi naman yun masyado nang matter sa akin kasi even in the Philippines, I have oncology experience. Pero syempre, iba pa rin yung dito sa Amerika. But luckily, when I came to this unit, I was thankful kasi hindi naman nila ako binigyan ng mahirap na pasyente. Although, on some units, kapag nag-float ka sa kanila, automatically you have the hardest assignment. But here on oncology, they gave me naman the patients that were not on chemotherapy, the patients who are supposed to be going home lang naman. So far, easy naman yung patient na binigay nila sa akin. But unfortunately, after that, they pulled me again and they float me to another unit. The unit that I don't really like. Kasi itong unit na to naman, the staff were very friendly so far. Pero they always gave the people who float there the hardest assignment. As in, hardest talaga. Like, I experienced admitting 2 patients, 15 minutes interval on the start of my shift. So, kailangan ko siyang kunin dun sa ED. Kasi may 30 minutes rule sila. So, dapat within 30 minutes na admit mo na yung pasyente. So, sabi ko nga, paano ko gagawin yung 30-minute rule dun sa isang pasyente? Kukunin ko pa yung isang pasyente. Parang sabi ko, just call the word. Talagang gabayan mo ako. Ayan. So, sabi ko talaga, yan yung mga time na talagang sabi ko, I need to get out of this city and to gather myself. Kasi talagang, it was hard. Siguro kung sasabihin ng iba na madali lang, it's common, well, lucky you. Pero, I don't normalize it na sasabihin ko na okay lang na mag-admit ng ganong kadaming pasyente or to have you don't care about the patient ratio. Well, good for you, but for me, it's really stressful. Hindi siya ganun kadali. Kahit ako, I always take everything as a challenge, but there are some na intolerable talaga. Like yun nga, you have to admit 2 patients, 15 minutes interval, you have to get the patient from the ED, and you have the 3 other patients that were waiting for their medications. Like, yun nga, nung kinuha ko yung isang pasyente ko, one of my patients were complaining about pain and he wants it now, and then his labs came up, sodium were very low, the patient was decreasing his sensorium, and then after I admitted the 2 patients, I need to transfer out this patient to ICU kasi kailangan niya mag-start ng correction for his sodium. So, sabi ko, una sa lahat, hindi ko naman unit. Una sa lahat, wala namang pasyente yung charge. Kumbaga, she can help me out with the admission if she wants to. Pero yun nga, minsan nasaklap talaga ang buhay. Na parang, they thought you were earning a lot of money and you deserve all the stress and this hard work for that. So, nung nangyari nga yun, sabi niya, you have to send a patient to ICU right now. So, sabi ko parang, you know what? I don't even know where your ICU was. And actually, I just started my contract here and I am drowning. Sinabi ko talaga sa kanya na, you know what? I'm really drowning. I don't know which thing I need to do first because I was admitting and this patient needs to go to ICU and I have other 2 patients who are waiting for me. Parang sabi ko, hindi talaga siya tolerable. Talagang sabi ko, I hate this floor. Ayoko na mag-float dito. Every time I floated there, it's really a disaster. Pero yung mga staff nga, the charge nurse were the one na parang ang hassle ng assignment. But the staff nurses were very nice so far. Yun nga yung sabi nila. Isipin ko na lang daw, nice naman sila. Kasi some of the staff there help me mag-pass ng medication. Tapos they know na parang lagi ako nabibigyan. Whenever I'm there, lagi ako nabibigyan ng pad assignment. So, yun nga. Sinasabi nga nila sa akin, don't mind her, yung charge nurse nga, she's crazy, parang ganyan. Tapos they will help me out. Kasi nung last time naman na pumunta na naman ako doon, ayan na naman siya. Pinag-admit niya ako ng ICU type of patient. So, this patient has meningitis, and then wala naman kaming room for that. Pero inakit niya pa rin. Siya yung kumuha ng pasyente, inakit niya dun sa unit, which is sana parang nakategorize na nila na ICU type of patient to. So, siguro an hour, naibigay lahat ng medications, ng antibiotics, inakyat din yung pasyente sa ICU. So, parang, yun nga, sabi ng mga staff doon, I feel so sorry for you. A waste of time yung ginawa ng charge nurse na yun. So, talagang, struggle siya. So, more of storytelling to, sorry. I want to generalize sana yung events na nangyayari as a travel nurse. So, yun nga, I'm not saying I'm not giving up kasi nga sabi ko I have another 13 week with that hospital. So, siguro another stress that caused me is nagpipick up kasi ako. Talaga naman kasi nagpipick up ako, nag-work talaga ako ng more than the expected hours. So, I used to like, my contract with this travel agency is only 36 hours a week. But I always pick up one shift. Para lang makompensate ba? Parang good, more compensation. But then, I realized, hindi nga rin siya better. Kasi, ang laki din ng tax. Kumbaga, the way I'm earning, from the way na nababawasan ako ng tax, I'm only just getting another $800 for a day. Hindi man lang siya nag 1,000 a day. So, for me, parang hindi naman siya enough. So, isa rin yun sa reason kung bakit ako nai-stress. Kasi, sometimes I work like 3 in a row, and this 3 in a row, I get floated into 3 different floors. So, I got 3 different sets of patients, which is, sasabihin ko ulit, hindi siya easy. Kahit sabihin ng ibang tao na it was easy for you, but for me, it wasn't. It wasn't talaga. It was very challenging. Ano pa ba? Yun nga, lagi kang first to float to get the hardest assignment. Yun lang. Yun. When I finish this contract, maybe I will re-evaluate myself again. Kasi, yun nga, even people were like asking bakit ako palipat-lipat ng hospital or ng work, it's because you have to test yourself kung saan ka talaga mag-work. Like this one, I experienced a lot of intolerable things. Then, parang, there are a lot of opportunities that you can hop into na hindi mo naman pwedeng stay. Like, I love reading Joel Austin's book na, yun nga, sabi niya doon, you're not a tree. If you want an opportunity, you need to get out of your roots to check kung saan ka talaga mag-work, kung saan ka mag-grow better. So, ayun, for me, if this travel nursing job or, yeah, this travel nursing job will not work on me, I don't care changing another, I don't care changing or checking another opportunities after this. Kumbaga, it's a good pay. Travel nursing is a good pay, but fast-paced siya. So, you can be floated anywhere. They expect you to learn everything in an instant. Kumbaga, hindi ka na masyadong i-guide ng mga tao doon. So, if you're the type of person na can be madali ka namang mag-adjust, I guess, well, travel nursing is a good resort. But, one thing I realized is that it's always not about the money. Kasi, like there, when I did my travel nursing job, I earned pretty well. But I also earned a lot of stress. So, in order for me to recover from that stress, I need to compensate it. Like, I do retail therapy, shopping ako, or mag-out of town ako. So, it makes no sense. Hindi rin ako makakaipon. Kasi, I need to recover myself with that amount of money that I had. So, yun lang naman yung aking realization with travel nursing. So, it's been a long vlog. So, maybe I can add up another input on my next vlog na lang. Kasi, ang hirap din i-upload kapag sobrang haba. So, kung may nanonood pa ng vlog ko, thank you for watching. Hindi na puro success yung makikita nyo sa akin. I can also share struggles and hardships here. And, of course, the reality that is happening here in America. So, thanks for watching!